Double chin will vanish. 3 exercises plastic surgeons don't want you to know. Every single day, 30 million adults over the age of 45 look in the mirror and see something that wasn't there 5 years ago. A soft fold of tissue hanging beneath the jawline. A shadow that changes the entire shape of their face. A double chin that appeared so gradually they didn't notice it forming, and now it refuses to leave no matter what they try. Not a small amount of loose skin, but a visible second contour, sometimes extending all the way down to the neck, transforming their profile into something they barely recognize. I'm going to tell you something that the cosmetic surgery industry absolutely does not want you to know. That double chin is not a fat problem. In 70% of cases, it's not even primarily about weight. It's a muscle failure, a structural collapse, and a postural adaptation that happens so slowly, your brain doesn't register the change until it's already severe. And here's what makes me angry after 15 years of clinical practice. You can reverse it without surgery, without injections, without spending thousands of dollars on procedures that carry real risks. But nobody in a consultation room is going to tell you that, because there is no revenue in teaching you 3 specific exercises that rebuild the architecture of your lower face. Subscribe to Dr. Waterling right now and hit that like button. We're working toward 1,000 subscribers, and we're building this channel on one principle. The healthcare industry profits when you believe your only option is expensive intervention. We profit when you solve problems at home with nothing but understanding and discipline. Let me be direct with you. The system you're navigating right now is designed to move you toward one endpoint: elective cosmetic procedures. Consultations for submental liposuction, which removes fat from under the chin, cost between $2,000 and $5,000. Kybella injections, which dissolve fat cells chemically, run $1 in $200 to $1 in $800 per treatment, and most people need 3 to 6 treatments. Neck lift surgery, the most invasive option, costs $5,000 to $8,000 and requires general anesthesia, incisions behind the ears, and weeks of recovery with visible swelling and bruising. Those procedures address fat. But what happens when the problem isn't fat? What happens when the structure beneath the skin has weakened? When the muscles that create jawline definition have atrophied from decades of underuse? When your head position has shifted forward by just 2 centimeters and created a biomechanical cascade that lets tissue sag under its own weight? Surgery doesn't fix that. You remove the fat, and 6 months later, the skin hangs loose because nothing is holding it up. I have seen this pattern dozens of times. Patient comes back after liposuction, thrilled with initial results, then devastated when the sagging returns because the underlying architecture was never repaired. Here's what's actually happening beneath your chin right now. There are 26 muscles in your neck and lower face. Most people reading this can name maybe 3 of them. The platysma is a broad, thin sheet of muscle that runs from your chest up to your lower jaw. Think of it as a structural hammock that should be holding everything tight and lifted. The digastric muscle connects your lower jaw to the hyoid bone in your throat, and it's responsible for jaw depression and swallowing mechanics. The mylohyoid muscle forms the floor of your mouth, creating a muscular sling between the 2 sides of your lower jaw. These muscles should be active dozens of times per day through full-range movements. Extreme jaw opening, neck extension, resistance against downward pull. But modern life has eliminated almost every activity that requires them. You don't chew tough food anymore. Everything is soft, processed, pre-cut. You don't look up. You look down at screens for 6 to 8 hours a day, which puts your head in forward flexion and deactivates the posterior neck muscles that counterbalance the anterior chain. You don't speak with full jaw articulation. You mumble, you text, you type. After the age of 40, you lose muscle mass at a rate of 1 to 2% per year if those muscles are not being actively stressed. That's not a theory. That's documented sarcopenia, age-related muscle loss, and it affects every muscle in your body, including the ones holding up your face. When the platysma weakens, it stops pulling the skin tight. When the digastric and mylohyoid atrophy, the floor of your mouth loses structural support. Gravity does what gravity does. Tissue descends. Fat that was previously held in place by muscle tone now sits in a visible pouch beneath your jaw. And here's the mechanism that almost no one explains. Your head weighs approximately 5 kilograms, about 11 pounds. For every centimeter your head shifts forward from neutral spinal alignment, the effective weight on your neck muscles increases by roughly 4. 5 kilograms. If your head is 5 centimeters forward, which is common for people who work at computers or look at phones for extended periods, your neck is supporting the equivalent of 27 kilograms, nearly 60 pounds. That chronic overload fatigues the posterior neck muscles, the ones at the back of your neck that should be keeping your head upright. When they fatigue, they stop firing properly. Your head drifts further forward. The anterior muscles, the ones at the front of your neck, now have to work in a lengthened, mechanically disadvantaged position. They're stretched out under constant tension but not contracting with any force. That combination, chronic stretch with no active contraction, is the perfect recipe for muscle atrophy and fascial laxity. Meanwhile, the fat pad under your chin, the submental fat, is not being compressed or dispersed by active muscle contraction the way it should be. In a healthy neck with active musculature, the repeated contraction of the platysma and digastric muscles literally massages that fat, encouraging lymphatic drainage and preventing accumulation. When those muscles go dormant, the fat just sits there. It doesn't get bigger necessarily, but it gets more visible because nothing is pulling the overlying skin tight anymore. Now, what does conventional medicine tell you when you walk into a consultation? They show you a mirror. They pinch the tissue under your chin. They tell you it's fat, it's genetic, it's aging, and your options are remove it surgically, dissolve it chemically, or live with it. At no point does anyone assess your neck muscle strength. At no point does anyone measure your forward head posture. At no point does anyone ask whether you can perform a chin tuck or a jaw depression against resistance, because those assessments don't lead to billable procedures. I had a patient, Margaret, 58 years old, who came to me 6 months after getting Cabela injections. She had paid $4,200 for 3 treatment sessions. The fat was gone, she confirmed that, but her neck looked worse. The skin hung in loose folds because there was no structural support underneath. She was now being quoted $6,500 for a neck lift to remove the excess skin. She asked me if there was any alternative. I assessed her neck muscle function. She could barely perform a proper chin tuck. Her platysma had almost no voluntary activation. I put her on a targeted exercise protocol. Within 8 weeks, her jawline had visibly lifted, not because we removed anything, but because we rebuilt the architecture that should have been holding everything in place from the beginning. The cosmetic surgery industry is not built to solve your problem. It is built to sell you procedures. There is no profit margin in teaching you how to activate your mylohyoid muscle. Your consultation will not include a postural assessment. And here's what makes this particularly insidious. The procedures work temporarily if all you have is fat. But if your problem is structural, if it's muscle atrophy and postural collapse, surgery gives you 6 months of improvement before the sagging returns. Then you're back for revision procedures, maintenance treatments, additional interventions, each one carrying risk and cost. Let me tell you exactly what you're going to do instead. 3 exercises, each one targeting a specific muscle group in the anterior neck and submental region, each one designed to rebuild strength, restore muscle tone, and create the structural lift that pulls skin tight and redefines your jawline. These are not stretches. These are resistance exercises that create progressive overload, the same principle that builds muscle in any part of your body. Exercise 1, resisted jaw depression. This targets the digastric muscle, the suprahyoid muscle group, and the anterior fibers of the platysma. Sit upright in a chair with your spine neutral, shoulders back, head balanced directly over your shoulders, not forward. Make a fist with your dominant hand. Place that fist directly under your chin, knuckles facing upward, pressed firmly against the underside of your jaw. Now, open your mouth against the resistance of your fist. Your fist is trying to keep your mouth closed. Your jaw muscles are trying to open it. Push down with your jaw hard, feeling the muscles under your chin contract forcefully. You should feel a distinct pulling sensation from the point of your chin all the way back to your throat. Hold that maximum contraction for 5 seconds. You're not moving. Your mouth doesn't actually open. This is an isometric hold at maximum effort. Release slowly over 2 seconds, bringing your jaw back to closed position. That's 1 repetition. Perform 10 repetitions. Rest for 30 seconds. Perform another set of 10. Rest for 30 seconds. Perform a final set of 10. Total 30 repetitions across 3 sets. Do this every single day. The muscle fibers under your chin have been dormant for years, possibly decades. They need daily stimulus to hypertrophy, to grow, to regain the tone and tension they've lost. You will feel fatigue in those muscles. That is the point. That fatigue is the signal that you're creating the micro-trauma necessary for adaptation and growth. Exercise 2, platysma activation with neck extension. This targets the platysma muscle specifically, the broad sheet that runs from your chest to your jaw and is primarily responsible for the lifted, tight appearance of your neck and lower face. Stand upright with your back against a wall, heels about 5 centimeters away from the wall, buttocks and shoulder blades touching the wall. This position ensures neutral spinal alignment and prevents you from using momentum or compensatory movements. Pull your chin straight back, performing a chin tuck that brings your head into alignment with your spine. You should feel the back of your head press gently against the wall. Now from this position, open your mouth as wide as you can, and pull the corners of your mouth downward towards your chest, creating a grimace, an exaggerated frown. You should see and feel the platysma muscle activate. It will create visible vertical bands running down the front of your neck. That is exactly what you want. Hold this position for 10 seconds at maximum contraction. You should feel intense tension from your collarbone all the way up to your jawline. Release slowly. Rest for 10 seconds. Repeat. Perform 8 repetitions. This exercise is brutally difficult if you've never isolated your platysma before. Most people cannot hold maximum contraction for 10 seconds on their first attempt. That's fine. Start with 5 seconds and progress to 10 seconds over the course of 2 weeks. Do this exercise once per day, preferably in front of a mirror, so you can confirm that the platysma is visibly contracting. The visual feedback is important because many people initially activate the wrong muscles, using their jaw muscles or their shoulder muscles instead of isolating the platysma. When done correctly, you will see those vertical bands appear on your neck. They should run from the center of your chest up to your jawline, symmetrical on both sides. Exercise 3, tongue press with chin tuck progression. This is the most technical of the 3 exercises and the one that produces the most dramatic results when performed correctly. It targets the mylohyoid, geniohyoid, and the deep stabilizers of the hyoid bone, the small U-shaped bone in your throat that serves as the anchor point for multiple neck muscles. Sit upright in a chair, spine neutral, head balanced. Place the tip of your tongue against the roof of your mouth, directly behind your upper front teeth. Now, press your entire tongue upward against the roof of your mouth with maximum force. Not just the tip. The entire tongue, from tip to back, flattened and pressed hard against your palate. You should feel muscles activate under your chin and deep in your throat. While maintaining that tongue pressure, perform a chin tuck, pulling your chin straight backward without tilting your head down. Your eyes should remain level. You're not looking down. You're retracting your head backward along a horizontal plane. As you perform this chin tuck with tongue pressed to the roof of your mouth, you should feel intense activation of the muscles under your chin, a deep pulling sensation that extends from your throat to the point of your chin. Hold this position for 8 seconds. Release the chin tuck first, allowing your head to return to neutral, but keep your tongue pressed to the roof of your mouth for an additional 2 seconds. Then release the tongue pressure. That's 1 repetition. Rest for 15 seconds. Perform 12 repetitions. This exercise rebuilds the muscular sling that forms the floor of your mouth and provides structural support to the entire submental region. When these muscles are strong and active, they create an upward lift that tightens the skin under your chin and creates visible jawline definition. When they're weak, everything sags. Here is your complete implementation protocol. Every morning, immediately after waking, before you check your phone, before you do anything else, perform all 3 exercises in sequence. Resisted jaw depression, 3 sets of 10 repetitions. Platysma activation with neck extension, 8 repetitions. Tongue press with chin tuck, 12 repetitions. Total time required, 8 to 10 minutes. You will feel fatigue. That is not weakness. That is your muscles responding to a demand they haven't experienced in years. The fatigue will decrease as the muscles adapt and strengthen. Within the first week, you will notice that the exercises feel easier. That is not a sign to stop. That is a sign that your muscles are adapting. At that point, increase the hold duration by 2 seconds for each exercise. Results timeline. Within 2 weeks, you will feel structural changes. The muscles under your chin will feel firmer when you touch them. By week 4, you will see visible changes in the mirror. Your jawline will appear more defined. The soft tissue under your chin will look tighter. By week 8 to 12, the improvement will be obvious to other people. They may not know what changed, but they'll notice your face looks lifted, more youthful, more structured. Now, let me address the obvious objection. Some of you are thinking, I've gained weight. The fat under my chin is from being overweight. If that's true, if you are carrying excess body fat and your double chin is primarily adipose tissue, these exercises will still help you, but you need to address body composition simultaneously. You cannot spot reduce fat. That is physiological reality. But you can rebuild the muscle structure underneath so that as you lose body fat through caloric deficit and general fat loss, the revealed structure is tight, lifted, and defined rather than loose and sagging. If you have genuine submental fat accumulation from weight gain, combine these exercises with a whole food diet focused on reducing refined carbohydrates and increasing protein intake to preserve muscle mass during fat loss. But do not skip the exercises thinking they're irrelevant until you lose weight. The muscle atrophy is happening regardless of your body fat percentage, and rebuilding that structure now means that when the fat comes off, you'll have a jawline worth revealing. How old are you? Write it in the comments. I want to see which age group makes up the majority of our viewers because it will directly shape what I cover in future videos. And if you're reading this and thinking I'm 65, is it too late for me? The answer is no. Muscle responds to progressive resistance training at any age. The adaptation may take slightly longer, but the mechanism is identical. I have worked with patients in their 70s who rebuilt neck muscle tone and saw visible facial lifting. Your muscles are not dead. They're dormant. Wake them up. One final critical point. If you notice a hard lump under your chin, a mass that feels distinct and separate from soft tissue, if you have difficulty swallowing, persistent hoarseness, or unexplained weight loss, see a doctor immediately. Those symptoms can indicate thyroid pathology, lymph node enlargement, or other conditions requiring medical evaluation. Everything discussed today supports normal muscle function and addresses structural sagging. It does not replace clinical examination when something requires professional assessment. The cosmetic surgery industry will continue selling procedures. They will continue positioning surgery and injections as your only real options. They will continue dismissing exercise-based interventions as insufficient or unrealistic. And they will continue profiting from the belief that your body cannot rebuild itself. But you now know the truth. You know the mechanism. You know the exercises. You know the protocol. You are not helpless in front of your own biology. Your face is not a fixed structure destined for inevitable decline. The muscles under your chin respond to the same training principles as every other muscle in your body. Stress them, let them recover, stress them again. That cycle builds strength, creates tone, and restores the architecture that defines your jawline and lifts your lower face. Subscribe to Dr. Waterling. Hit that like button. And if this video helped you, send it to someone you care about, a parent, a friend, someone who's been considering cosmetic procedures but might benefit from understanding they have another option. You may have just saved them thousands of dollars and given them back control over their own face. Your double chin is not a verdict. It is a signal that specific muscles have weakened and specific postural patterns have created structural collapse. Now you have the tools to reverse it. Use them.